People just want simplified things. So number one, simplify their world. Set them up to win. Set them up for success. What's happening, everybody? Welcome back to the podcast. New listeners, welcome. Anybody coming back on to the show and the channel, welcome back. All right, this podcast topic comes from some fiery conversation I had with my queen, my boss, the almighty Stephanie Garcia. So I had to share. We were talking about what makes people very successful and the things that don't make you successful and the habits that can ruin your credibility as a PT. Are you ready? Let's do this. Have you ever gone to let's do something we can all resonate with. Have you ever gone to a car mechanic and you say, hey, my brakes are squeaking. My car is shaking. It makes this funny noise when, and you insert your problem. And that person delivers with the response that you were not looking for. You ready? Well, it could be this, it could be that, it could be this or that or this or that. And you're like, so what is it? And they simply say it could be 20 different things, and they don't seem like they know what they're doing, and you get frustrated and you actually lose confidence in their ability to deliver the service. So you're like, I don't even know if this is the right person. This can happen with your patients and clients who go to a physician or let's say an ortho, and they're like, hey, I've had this pinchy, medial knee pain, and it hurts with deep knee flexion and twisting and this or that. And the ortho says, well, it could be this, maybe that. I'm not sure. When I get in there, I can let you know. And you're like, why am I even here then? Like, can we start on a MRI? Can we start rehab? I mean, so in all those, there's both those instances, you're getting a response that maybe you're like, I just don't know if this is for me. I can't get confident in your skill set. And that lends to how confident you are and the confidence in that person, the delivery of the message. And let me bring it home to some of you in the clinical world. And if you're a student, you can resonate with this as well. How many times have you said this to somebody else? You ready? To a patient or a client. All right. It's at the end of the session and you just finished up their evaluation and you did all the measurements, and now you're about to deliver everything and summarize it and exercises have to do. And this is what I've heard in the past, and you tell me how great this sounds or not great this sounds when we combine it with the mechanic example or the ortho example. You ready? All right, Mrs. Jones, you have inside knee pain, and I'm going to give you these 4 exercises, and you're going to do them each. Ready? 2 to 3 sets, 10 to 15 repetitions, 4 to 5 days a week for 10 to 12 weeks. Do you see how that's confusing? So which one is it? Like, do I do 2 or 3 sets? Do I do 10 or 15 reps? Do I do 4 or 5 days a week? Or do I do 10 or 12 weeks? There's so many variables in there. And when you, the provider, what you forget is that you haven't been in that vulnerable situation like the patient or the client. And so when you're vulnerable, you hang on to every word that specialist or that leader says. If you were to go to your mechanic and they said, well, it's your brake pads and this axle, or this brake part and this and this and this, and it's also part of this, your take home message was like, it's a little bit of everything. All you want is to fix it. And when you confuse people more, they're less secure in what you're doing for them. Yes, they want the outcome, but most of the time people are coming to see you so they can be informed. And I've said this before in a different podcast. People want three things: education, motivation, or accountability. And when we go to a car mechanic, you just want the education. Tell me what it is and fix it. Or ortho, tell me what it is and fix it. The problem with uh, PT as a profession is that we have the brain involved, and pain is, it's not like accounting where it's like A plus B equals this. When you have the brain and you have proprioceptors, the perception of pain is now, you have a psychosomatic and a neurological, neuromuscular connection. And when you have that, it's not that simple, because now you have people's prior history and how that impacts their belief in pain. So when you're looking for an outcome, yes, you just want it solved. So when people come to see you, I'm going to give you some examples of habits that will ruin your credibility as a PT. And the first one I just gave you: stop saying 2 to 3 sets, 10 to 15 reps, 4 to 5 days a week for 10 to 12 weeks. Instead, you know what's easier? 2 sets of 10 daily for the next 4 weeks. 3 sets of 8, 3 days a week for the next 6 weeks. That's more clear, and people can focus on one thing. Think about this. They just got inundated with paperwork. If you're insurance based, then they had to go through that whole process. They just drove through traffic to find you, filled out all this paperwork, gave it to the front desk. They come to see you, you're taking 2,700 measurements, and they're just lost. And what you did was just confuse them more. Think about that. Insurance, traffic, paperwork, late to the appointment, on your table, overwhelmed with the measurements and data and information you just provided, and now they want the solution, and then you make the solution complicated. People just want simplified things. So number one, simplify their world. Set them up to win. Set them up for success. 1 set of 5 reps every single day for the next 6 weeks. Sounds good? If I'm seeing you next week, or I'm seeing you every week, 1 set of 3 every single day until I see you next time. Sounds good. I can remember that. Versus 1 to 3 sets, 15 to 22 reps, 4 to 6 times a week, and the next 3 to 27 weeks. It's too complex. People can't understand that. All right, that's number one. Number two, let's clean up the vocabulary. And I have these discussions with the team all the time here at Sports Performance. Here we go. You ready? Here's some phrases that you don't want your dentist, your ortho, your accountant ever saying. You ready? I think that would be a good idea. I think that'd be a good idea if we do a knee surgery on you. Yeah, I think it'd be really good. What? You think? Yeah, you should get knee surgery on that. Yeah, you should. Okay, I should. Got it. Um, yeah, it looks like your meniscus. Mm, yeah, it's your meniscus. So just in those three examples, I gave you I think, it should, and We're going back to elementary school. Doesn't give people confidence. Inserted in the wrong sentence, the wrong time, leads people down a wrong path. When you have surgery, you're going to feel 90% better. How about you just leave the out of there? After surgery, you're going to feel 90% better. There's a difference in that. Big difference. After doing these exercises, you're going to feel 50% better. At least you give people a path. And the problem is that you don't feel confident in your skill set that you're going to get them there, and that's why you say 50 to 90% better. And when people give ranges, it's because when they're not confident. Think about that. The only time that you give a range is when you're not sure if you're going to achieve it. But if you give people a good estimate that helps give them confidence that you are actually credible in your skill set. Now, I don't care if you're the best physical therapist on the planet. 100% is very hard. I generally will give them 91% improvement. You see how I delivered that message? Not very confident. I'll tell my clients, I can get you 90% better. However, that requires that you are actively involved in this. If you're not actively involved, 25%. Instead of saying 25 to 90% improvement, I'm saying you do your homework. I'll do my part, you do your part. You don't do your part, I can only do so much. This should help. Should help? It will help. I know I can get you better. This will help if you do your exercises. Not should. And part of that is believing that you can actually do it for them. People who don't believe in themselves give ranges. It should help. Yeah, 50 to 90%. 22 to 87%. I think. People don't want to see you for I think. Different way to say that is, it can be these two options. I'm going to see you for 4 weeks. We're going to try this. If that does not work, it's likely the other option. I think this is going to work. Doesn't sound very confident to the people that you serve. So I think this should help. And Here's 2 more examples. Maybe. Maybe is the same as should, I think. Maybe tells them that you're not confident or sure this is going to help. Maybe. So if I do all these exercises, it's going to help. Maybe. Then why am I seeing you? For maybe, I can do YouTube exercises, Google, Instagram. Find the 20,000 people on Instagram giving exercises. That's a maybe. Why are they coming to see you? I think if you understand their pathway, it depends on the person, their age group, their activity level, all the above. But if somebody's already been to Google, did all those exercises, then went to YouTube, tried the clamshells, tried the 20,000 rotator cuff exercises out there on the planet, if they already tried those things, they're not looking for the maybes or the shoulds and the and the I thinks. They're just tired. They just want you to narrow down all this information and consolidate it into what they need to do. That's it. Take all this information and simplify it for them. That's it. Or else they would have done it on their own. Before the internet, before Instagram was big and, we have all these people posting, before that, people trusted you and as a provider. Now they can't tell if you're, a performance person or a massage therapist giving exercises. The public doesn't know, and it's not their fault. They shouldn't have to know. It's your job to prove it to them. And when you deliver a message with limited confidence, the credibility that you have drops. Why is this important? Because if you want people coming back to you, it's critical that you do that. And your overall credibility. the clinic that you work in, your coworkers, your peers, they want to know that you're confident as well. And they're listening to you too. And think about this. All of us have a favorite body region. Mine is the hip and low back area, SI. Give me it. I love it. I love working with that region because I'm very confident in my skill set. I'm also very passionate about it. Now, you all have a region that you don't love working on. Maybe it's extremities, maybe it's a shoulder, and you're like, I don't like necks, I don't like shoulders. I just have a really hard time. I took a really good CEU course 10 years ago, and I can't seem to remember any of it. On those areas of weakness or areas of improvement, that's when you start bringing out the shoulds, coulds, maybe, I think. But the first thing you have to know is when you're saying it. And it might not be just your clinical practice. It might be your areas of improvement. For some of us, as a new grad, you're saying it more than you think. You actually are. And I'm telling you this because we see a lot of clinicians who apply into sports performance. We work with a lot of new grads. I've mentored a lot of new grads. I've worked in a DPT program. I've taught, I've instructed. And it's just the nature of being new or unfamiliar to something. And it's a natural filler in what we say and how we say things. All I'm doing is bringing this to your attention. The one thing that your patients and clients deserve, they deserve it, is confidence. They deserve that. And it's your fault that you don't have confidence. Nobody else's. They didn't fail their treatment because they didn't know how to do exercises. It's your job to just put them on that path. Just kickstart them. Get them on the path to feeling better. But they also have to see the value. And that value is created with the confidence that you deliver during the sessions, whatever it is. 1 visit, 12 visits, whatever the script pad is, or whatever you set for them. And just like your mechanic, an ortho, an accountant, a dentist, yeah, it could be a cavity. You'll feel, I think you should be feeling 20% better. And then you meet superstars, rock stars. Hey, we'll get that cleaned up. You'll feel 92% better. Here's a big one. You ready? What if an airline pilot, you're on the airplane, you're about to take off, and the pilot says, we're going to Tahiti, and based on the wind, we might get there in 3.5 hours to 4 hours with a little bit of turbulence. Okay, I get that. Let's switch it and say a different pilot says, good morning, everyone. You'll be in Tahiti in 3 hours and 51 minutes. If there's a little turbulence, it will be 3 hours and 57 minutes. Who do you have more confidence in? The one who told you exactly when it was going to happen. And if it doesn't happen exactly, they're going to be pretty close, and you trust them. That confidence. When I step on that plane, somebody says you'll be there in 3 hours and 51 minutes and 22 seconds. I want that pilot. What kind of pilot are you? 3 hours and 15 minutes to 4 hours, maybe. We should be there fine. We should hit a little bit of we might hit a little turbulence. I think 3 hours and 52 minutes, may give or take 10 to 15 minutes. That's what we sound like when we deliver exercises in ranges with fillers, with no confidence, slouched posture, no eye contact, fillers and ranges. Why would you trust anybody? Get the shoulders back, be tall, look at them in the eyes. 1 set of 3 every single day for the next week. Same as your primary care saying, take these pain pills every other day, 200 to 400 milligrams 5 to 7 days a week? Which one is it? Physicians are fantastic at this. Take these every single day, 3 times a day, and for the next 2 weeks until I see you again. Sounds good. And they say it with confidence, man. They come in, just what it is, script pad, walk away. You're like, well, okay, sounds good. I got my script pad, I gotta go. And then clinicians, yeah, so we're gonna see you 2 to 3 times a week, and you're gonna do these 3 to 5 sets, 4 to 5 times a week, 10 to 12 weeks, and I'm gonna see you every other day for the next 5 to 10 days. There's too many numbers. It's just too much. Clean it up. Reduce your fillers. Improve your posture, eye contact, and deliver with that darn thing that you always want, confidence. It's You love it when you have people who deliver a service with confidence. All of us love it. The problem is we can't give it, and it's not just experience. I mean, you have some. I see some students that come in, some interns come in, strong, confidence. I love that. You ever become an intern at Sports Performance, I'm gonna call you out. I think that's great. Whatever got you, and I've said this on a podcast before, whatever got you to where you are won't get you to that next step. Whatever got you there won't keep you there. And I'm just gonna push people to have more confidence. Why? Because your patients and clients need it. You love it when somebody gives it to you. The problem is you don't see yourself in their shoes. We're all service-based world. We're all service-based in what we do. Every business is in service. And that one thing that your patients and clients deserve is confidence. And I just wanted to share those habits that can ruin your credibility as a PT. And there you have it. And, clean up your vocabulary, clean up the fillers, minimize your percentages, and that'll set you up for success. So, 3 massive habits to improve your credibility, or flipped, that will ruin your credibility as a PT. There you have it. All right, I will see you next time. No more ums. 3 to 5 times a week, 4 to 6 times a week. I don't know, whatever it is. Stop it. No ums. Confidence. Eye level. I'll see you in the next episode. Cheers.